Okay, let's unpack this. Our doctors, the people we rely on when we're at our most vulnerable, turns out they face elevated rates of mental health challenges, things like depression, anxiety, and a higher risk of suicide compared to almost any other profession. It's a serious issue. So for this deep dive, we're looking at a brand new systematic review and meta-analysis from Nature Mental Health. It really cuts through the noise, trying to tell us what actually works to support their well-being.
Right. And what's really key here is that this research pulls together evidence specifically on interventions for physicians. It helps answer those crucial questions about, what's effective, what kind of approach, how should it be delivered, especially considering everything that's happened recently, like the pandemic pressures.
So what does this all mean then? For doctors, for the people supporting them, the good news is it sounds like things can help.
Yes, absolutely. Physician-directed interventions do work. That's a clear takeaway. This deep dive shows a significant reduction in symptoms of common mental disorders, like depression and anxiety, among physicians participating.
Okay, a significant reduction. That sounds promising.
Indeed. The analysis found what we'd call a moderate reduction in symptoms right after the interventions finished. The standardized mean difference was 0.45 for those interested in the stats. And what's really encouraging is that this positive effect was maintained even at follow-up. Sometimes it's 12 months later. The effect size there was 0.48. So it suggests a real and lasting impact, not just a temporary boost.
That's huge. Lasting impact is exactly what's needed. But here's where it gets really interesting for me. When we look at what kind of interventions were most effective, what did the review find there?
Yeah, this is where the details really matter. Skills-based approaches definitely shine. The data indicates that mindfulness and mind-body-based interventions, they led to a medium-sized positive effect, an SMD of 0.50.
Okay, mindfulness, mind-body. Makes sense. What else?
Well, other skills-based approaches, things like cognitive behavioral therapy, CBT, stress management techniques, even peer support, they actually showed stronger effects, quite a bit stronger, actually,
Okay.
an SMD of 0.74.
Wow, okay.
But contrast that with interventions that were purely psychoeducational, just sort of learning about stress or mental health. Those did not yield a significant effect. So it seems just giving information isn't enough. You need the practical tools, the skills.
Active skill building, right. And how were these delivered? Did face-to-face versus digital make a difference?
It did. Face-to-face interventions showed a moderate positive effect, an SMD of 0.60. Digital interventions, on the other hand, had a smaller effect, and it wasn't statistically significant in this analysis, an SMD of 0.35.
Interesting. So that in-person connection might still be really important.
It appears so from this data. Maybe the engagement, the direct feedback, something about it seems more potent. And interestingly, the effectiveness didn't really change much whether the interventions happened before or during the COVID-19 pandemic.
Okay, so while these findings definitely offer some real hope, you mentioned this deep dive also highlights some gaps, concerning gaps.
Yes. And this is critical. It raises a really important question. We have strong evidence that workplace factors, the environment, the system, heavily influence mental health. Yet there's still basically a complete absence of controlled research studies looking at organizational-level interventions, things aimed at changing the system itself.
Really? No studies on changing the workplace?
None that met the criteria for this high-level review. It's a persistent and, frankly, urgent gap, especially when you consider the multi-level approaches tackling both individual and organizational factors are seen as best practice internationally for workplace mental health.
That seems like a massive oversight.
It really is. And furthermore, very few studies, only 2 were identified here, actually assess suicide-related outcomes, which is particularly troubling given the known higher risk of suicide in this profession.
Right.
We need much more focus there.
Right. So, okay, individual skills training, group support, those things can make a difference for physicians, which is good. But we're missing this huge piece of the puzzle, the organizational side.
Exactly. So for you, the listener, this means understanding that supporting our medical professionals really needs a multifaceted approach. Yes, emphasizing skills development for the individual is important. We see that works. But critically, there's this huge unmet need for systemic changes within healthcare organizations themselves, fixing the environment they work in.
So it's not just about helping doctors cope, but changing what they have to cope with.
Precisely. Empower the individual, yes, but also fix the system.
Which leaves us with something to mull over, doesn't it? How can we as patients, as a society, bridge this gap? How do we advocate for those broader organizational level changes that could truly transform physician well-being? That seems like the next crucial step.